Growing evidence demonstrates that people with obesity experience higher level of social isolation and loneliness compared to those who are not obese. In a recent study, researchers analyzed the link between improvement of social isolation and loneliness with mortality risk among 398,972 UK biobank participants with or without obesity. Results showed that as social isolation and loneliness improved, the risk of all-cause mortality was reduced by 36% and 9% among participants with obesity compared with those without obesity. In determining the lifestyle risk factors for mortality risk, social isolation was at the top of the list. Other risk factors include loneliness, depression, and anxiety. The findings were published on 22nd January in JAMA Network, a reputed science journal. Loneliness and social isolation in older adults are serious public health risks affecting a significant number of people in the United States and putting them at a risk for dementia and other medical conditions. A report from the National Academies of Science and Engineering and Medicine (NASEM) points out that more than 1/3 of adults aged 45 and older feel lonely, and nearly 1/4 of adults aged 65 and older are considered to be socially isolated. Other adults are at the risk of loneliness and social isolation because they are more likely to face factors such as living alone, the loss of family or friends, chronic illness, and hearing loss. Loneliness is the feeling of being alone, regardless of the amount of social contact. Social isolation is a lack of social connection. Social isolation can lead to loneliness in some people, while others feel lonely without being isolated socially. Although it's hard to measure social isolation and loneliness precisely, but there is a strong evidence that many adults aged 50 and older are socially isolated or lonely in ways that put their health at risk. Recent studies found that social isolation significantly increased a person's risk of premature death from all causes, a risk that may rival those of smoking, obesity, and physical inactivity. Social isolation was associated with about 50% increased risk of dementia. Poor social relationship characterized by social isolation or loneliness were associated with 29% increased risk of heart disease and 32% increased risk of stroke. Loneliness was associated with higher rates of depression, anxiety, and suicide. And loneliness among heart failure patients was associated with a nearly 4 times increased risk of death and 68% increased risk of hospitalizations and 57% increased risk of emergency department visits. As per the experts at UT Health Houston, social isolation and loneliness has appropriately received attention from healthcare professionals and has been associated with adverse health outcomes. This study was particularly interesting as it demonstrated that lower social isolation or loneliness was associated with a decreased risk of all-cause mortality among people with obesity, and improvement of social isolation and loneliness attenuated obesity-related excess risk of all-cause mortality. So now the big question is, what's the link between obesity and social isolation? If an individual doesn't have a strong support system, it can lead to an increase in unhealthy behaviors, including diet. Experts believe that obesity, social isolation, and loneliness are all associated with many health issues. A lack of social support may intensify the health risk behaviors of people with obesity, including smoking, inactivity, and unhealthy diets, and might neglect health productive behaviors such as adherence to medical recommendations. Moreover, those who live alone or lack social contacts may be at a heightened risk of death if they develop acute symptoms, because they might not have a strong network of friends to urge them to seek medical attention. Addressing social isolation and loneliness in individuals with obesity may potentially help improve unhealthy lifestyles, provide better psychological support, and encourage people at high risk to seek medical assistance when necessary. Medical experts say with improved socialization, participants may be more motivated by peers to engage in healthy behaviors. They may seek out treatments and be more likely to follow up with medical care. So that brings us to the end of today's story about loneliness and health problems. For more medical updates, please do subscribe the channel. Thanks for watching. Signing off for now and have a great day ahead. Thank you.